Hello everyone. My name is Vincent Keane and I am President and CEO of Unity Healthcare. And I would like to welcome all of you to our virtual donor event. This is an opportunity for me and for all of Unity to thank you so much for your generosity. Your generosity has been evident in particular over the last year and a half as we have dealt with the COVID crisis in our midst. You have been so generous that you have enabled us to continue to provide vital services for our patients in the District of Columbia. And I would like to begin this donor event with just pointing out where we are this morning. We are located here in DC, Northwest, outside the Federal City Shelter, where Unity has a healthcare clinic that serves homeless people 6 days a week. Why is this special? Well, it's special to me, and it's special to our mission. For over 35 years, our dedicated staff have been working in this shelter, providing healthcare and vital life links to thousands and thousands of homeless people over those years. I am delighted that this is the starting ground of our event today. However, it's not the only place where we will be exposing you to the work of Unity. You will get a chance to see the Upper Cardosa Health Center. You will get a chance to talk to some of our patients and other staff. In the last year and a half, Unity has never wavered in its mission of service to the most disadvantaged people. That was accomplished by so many of our wonderful staff. And here now to tell you a little more about that is our dedicated Chief Medical Officer, Dr. Jessica Boyd.
Thank you so much, Vince. I'm honored to be able to speak a little bit about what Unity has done during the pandemic to help our patients. And in March of 2020, we were faced with the crisis that everyone in the country was. What do we need to do to help protect our patients from coronavirus and COVID-19? One of our primary strategies was to set up these respiratory evaluation clinics. And we did them in tents, often outdoors here, to help set up a safe environment for our staff and our patients. And these tents allowed us to test tens of thousands of patients for coronavirus during the pandemic. And maybe it's important to recognize that our patients are essential workers and they are part of the critical infrastructure of the country. So we needed to have our tents operational from 8 a.m. until 9 p.m. during the weekdays and on both Saturdays and Sundays, so that our patients were able to get tested when it was convenient for them and be able to understand their own risk, get care for COVID if they happen to get it, and also to protect their families and their loved ones. So our homeless outreach van, our mobile van, has played such an important role for us this year in helping to manage the pandemic and the health of our patients experiencing homelessness. For example, the van was really instrumental in our vaccination clinics and our vaccination efforts. So we were able to set up vaccination clinics at many of the low barrier shelters and vaccinate those who were residing there at the time. We also were able to go out to the encampments and provide vaccinations to the folks who may choose not to visit a shelter but still needed health care. And I think it's also really important to say that we didn't just use the van for vaccinations, but we were able to provide primary care services and whatever healthcare services our patients needed on the van directly. So being able to bring care to where patients are is really critical during this time. So as the pandemic progressed, we needed to develop really a three-pronged strategy to impact the health of our patients. We continued our respiratory and evaluation clinics as part of our COVID care. We wanted to enhance our resulting so that people knew more quickly if they had COVID or not. And we wanted to make sure we were following up on patients throughout the course of their illness if they were to be sick, to make sure that we were helping to reduce the mortality and morbidity for patients, particularly those of color, who were having disparate outcomes. The second prong of the strategy was primary care. So we've talked about how we remained open, but as the pandemic progressed, we really wanted to reopen and continue to have our community health spaces as a safe place for patients to get care. And that meant helping people to navigate preventative services like cancer prevention. It meant bringing children back in for their well child exams and their vaccinations to get ready to go back to school. And it means ensuring that our patients who have chronic diseases are getting that necessary education and advice and medication management so that their health was optimized. The third prong is really vaccination and prevention. And at the end of the year, there was nothing but hope as the vaccine was coming, and we were making plans for how we would provide this essential, critical preventive service to our patients. So in December 2020, when the Moderna vaccine was approved, we were notified that we would be getting a supply to be able to provide to our patients, which was just wonderful because we wanted health equity to be at the front of vaccination for COVID. When we were planning, we realized we needed spaces that could be safe for our patients and could accommodate a large number, as we were hoping to vaccinate as many as possible. We started at our Upper Cardozo and our Brentwood locations, and we were just pleased to partner with many organizations, and specifically Israel Manor Inc., to create vaccine clinics like this one here at the Capital City Hall of Distinction, where we have been able to vaccinate over 30,000 doses of vaccine and over 17,000 people. So we started these 2 clinics in December, and we were able to expand to 5 additional clinics throughout the city. And we've also been vaccinating those experiencing homelessness at low barrier shelters throughout the city and at our CCNV facility, as well as in the encampments. Today, in June, the city is reopening, and many of our centers are reopening, and we're welcoming back our patients. And I just want to take a moment to say thank you to our patients and our community for being there with us during this crisis, and hopefully we've been able to serve you. Healthier patients mean healthier communities, and that is what Unity stands for. So thank you. And now I would like to introduce you to Dr. Amanda Slater, who's one of our family medicine physicians at our Upper Cardozo facility and one of our associate medical directors, and she'll be giving you a tour.
Hello, welcome to Upper Cardozo Clinic. My name is Amanda Slater. I have been a doctor here for almost 20 years. As I'm introducing you to our clinic, I'd like to show you first our amazing mural. It represents many of the different communities we serve. The other thing I like about this mural is that I feel it represents also the staff at our site, which is also very multicultural from many different countries. And here at Unity, we are all about serving the community. Welcome to my clinic. Our clinic is divided into different clinics, and they're arranged by color. This clinic, the Bronze Clinic, is where we have primarily residents. We have a residency program for doctors of osteopathy where they are enmeshed in the community and get a really profound grounding in community medicine, from which they are able to go all over the country to be really good family doctors. But the best part about it is that very many of them choose to stay with us. So let's talk a little bit about the residency. We have 3 residents a year, so 9 in total for a 3-year residency in family medicine. They come in with a grounding in osteopathy, and they add to that a very deep understanding of how to care for underserved communities. One of the things that the residents are most valued for by the rest of us is that they do procedures. So if you look in this little room, we have this wonderful little procedure room where we can freeze off warts, they can do biopsies, they do a lot of family planning, and anything else that might require a small procedure, knee injections, shoulder injections. The beauty of the procedure clinic is that it is a way that we can relieve pain in the moment. The rest of us who are always negotiating chronic care don't have as much opportunity to relieve pain in the moment. So this is a great blessing. I'd like to draw your attention to the books. We have a partnership with Reach Out and Read, and children get a book at every well child visit between the ages of 6 months and 2.5 years. We're also very careful to remind them that there is an opportunity through the city called Books from Birth, where they can have a book mailed to them every month for the first 5 years of their lives. One of the most extraordinary things that has happened in the last few years is that we have brought a pharmacy on site. It is absolutely wonderful to be able to have a conversation with a pharmacist in real time to get problems solved, prior authorizations, medicines that are not available. They will reach out to us in the moment and say, hey, can you change this prescription to something that we actually have in stock so our patients can get their medicines while they're here. Another great benefit of the pharmacy is during the era of COVID, they have figured out a way that they can deliver medicines. This is, now we have come into the red team. The red team is where most of our same day and walk-in visits happen. As you can see, here's a red team waiting room. Being able to care for people on a walk-in basis or on a same-day basis, because they're now able to make appointments 24 hours in advance for acute needs, is a very important part of being a patient-centered medical home. The other interesting thing about the red team is that it is where we often welcome people who have never been to a clinic before in this country, people who have recently arrived, bringing bags of medicines in other languages, people whose medicines have run out on the journey, and they know that they can come here to get care without any barriers. So again, the red team looks very much like other teams. We have some of our providers here who are diligently finishing their notes on our electronic medical records. The other nice thing about the red team is it leads directly to the lab. So let's go to the lab, because frequently we do need to send people there straight from seeing us in walk-in. Now we're going to drop into the lab. I cannot tell you how valuable having a lab on site is. The person who is responsible for the communication between the LabCorp site and the providers has been one of our medical assistants for probably as long as I have been here. That ability to have a personal connection with the rest of the people who are helping take care of our patients is very efficient, and it means it's easier for me to take good care of my patients. Now we're going to visit the COVID tent. Here we are at the COVID tent. We've had it up for about 13 months, and it showed up quite quickly, and to develop a protocol for seeing patients in the tent has been a real benefit to the community. At the height of COVID, we were seeing an extraordinary number of patients in our tent. I think we were seeing probably 60 patients a day at the tent, which meant each provider over a 4-hour period would see about 20 patients, swab them, give them advice, send them on their way, and arrange for them to get follow-up by telephone in a few days to make sure they were feeling better. It was very clear, and it continues to be very clear, that we have been serving a vital need for this community by having this tent here. Next, we're going to go up to the second team, which is where our blue and yellow teams are located. This is the heart of our primary care. This is where most of the primary care visits happen in Upper Cardozo. Now we're on the second floor of Upper Cardozo. As you can see, we've divided this floor into yellow and blue, and we do most of our family practice here. We do all kinds of medical care here. We take care of newborns. We have the entire spectrum of life on this floor. And we also have integrated within our clinics behavioral health clinicians. Their offices are back here. There's a psychiatric nurse practitioners, psychologists, and behavioral health clinicians who have offices back here, but they will come in and see patients with us, which is part of an integrative model that we're working very hard to promulgate at Upper Cardozo and at Unity as a whole. We're walking into the blue team waiting room. In the time before COVID, we had quite a few group visits that we would do. One of them was a TREM program, and it was for patients who have experienced significant trauma to come together as a group under the care of a mental health professional. COVID has been very hard on our community. We've lost a lot of patients. We ourselves as providers have lost a lot of patients, and our patients have lost a lot of their families. It has been devastating to our community, and I cannot tell you with enough words and enough passion, how grateful I am that we are able to provide vaccines. Although vaccine is now readily available throughout the city, our patients prefer to come here to get their vaccines. Like I said, we see children and grown-ups and everybody in between on this floor. We take care of a lot of children at Upper Cardozo. We're very proud of our vaccination rates. We try very hard to get children vaccinated. We make great use of our electronic medical records to make sure that children don't fall through those gaps. Another great service we are able to provide is that there is a person on site from the Office of the Superintendent for Education, or OSSE, who helps to plug children in to care within the public school system, because really, as I've mentioned before, so much of what makes us an effective community is the personal interactions or the personal connections with staff that's been around for a long time. It's just another way that Upper Cardozo and Unity are so well integrated into the community and are able to provide these services efficiently. Now we're going to go into the provider area between the two teams, the yellow team and the blue team. In addition to providing comprehensive family planning, medically assisted therapy for people with addictions, and comprehensive HIV care, we also have psychiatrists on staff, so patients who need medically assisted therapy. I will come back here to the provider area and I will do what we would call a warm handoff to another provider to say, hey, would you mind taking this patient on to provide them a service that I can't give? Also, we have an HIV team and they will cluster here and talk to us about the comprehensive medical needs of patients. This is the yellow team. It is very much like the blue team, but it is also where our own resident nature doc has his offices. One of our providers, Dr. Robert Czar, has started a program called Park RX, which encourages children to get outside for their both physical and mental health. And he is a profound proponent for nature, for getting outside, and he sees patients through these offices here. So now we're going up to the third floor. The third floor features the WIC program, which provides nutrition to children, and also our very comprehensive dental department. So this is our WIC department. Through this program, we can provide nutritional support to babies, young children, and their mothers. This entails not just getting their coupons for formula and for foods, but also breastfeeding support, breast pumps, and other nutritional counseling. There is an opportunity also to get coupons for use at farmers markets. Next, we're going to go to dental. This is our dental department. We are able to provide dental services to tiny little children all the way up. We do a lot of cleanings, fillings, crowns, some dentures, and some oral surgery. And one of the nice things about being in the same building with the primary care doctors is that if they do need to be referred out, we can provide them with their preoperative care as well. Now we're going to the fourth floor, where we're going to see the podiatry and the ophthalmology departments. We are now on the fourth floor of Upper Cardozo. Again, these teams are purple and green, so we have two colors. And family practice is integrated into each of these teams, but because of the specialized equipment required for ophthalmology, podiatry, and some gynecology, many of our services for those particular specialties are focused here. Another great gift of working at Upper Cardozo is being able to provide comprehensive care to our prenatal patients. We don't have a dedicated ultrasonographer on staff, but we do have basic ultrasound knowledge among our gynecologists. So any of the acute needs of our patients who are pregnant can be met on site. This ultrasound machine allows us to be able to check on the health of the baby, to make sure the heart is beating properly, to make sure the baby's head is in the right direction, and to alert us if there are more serious things going on so that we don't, again, delay care. Now we are going into one of our two podiatry suites. As you can see, there's specialized equipment to make it easier for the podiatrist to tend to people's feet and ankles. Being able to provide care for the feet is another great blessing that we are able to provide at Upper Cardozo. Podiatry services to the community is a hallmark of the comprehensive care that we are able to give. I'd like to now draw your attention to our ophthalmology department, which is really the other half of diabetic care and is also critically important to keeping our diabetic patients healthy. This is our ophthalmology suite. This equipment helps us to be able to evaluate our diabetics. Other services we are able to provide are prescriptions if needed and acute care of the eye. Again, when we talk about being able to provide services in the moment, we can frequently come upstairs if our patients are suffering from acute issues, corneal abrasions, infections, concern for things that look strange to us but would make sense to the ophthalmologist, and we can take care of them all in the moment. That concludes our tour. Thank you so much for joining us as I try to show you how much the donor support for our work helps me to take good care of patients.
Thank you, Amanda. Thank you for helping our donors understand the great work we do. I hope you have enjoyed our visit to the largest health center that we have in the District of Columbia. But it's not just one. We have several health centers throughout 8 wards of the district. And this is just a sample of the care we give in each one of those wards. We could not do it without your support, and we ask you to continue generously to support our efforts of improving the lives of patients here in DC. Thank you.
Thank you, team, for that wonderful tour of Unity's Upper Cardozo Health Center. I am Dr. Destiny Simone Ramjan, and I am proud to serve as the Vice President of Community Health and Social Impact with CareFirst Blue Cross Blue Shield. I am also extremely proud of all of the difference makers of the Community Health and Social Impact team that have contributed countless long days and hours to address the COVID-19 pandemic for the most vulnerable members and neighbors in our communities where we live, work, play, pray, and seek care. To date, CareFirst has invested over $4.5 million in nonprofit organizations working on the front lines to provide relief for communities' health, economic, and social needs brought on by or exacerbated by the pandemic and beyond. These funds have already begun closing gaps in medical care access, addressing inequities in the reach of vaccine implementation efforts, minimizing food insecurity, and supporting the needs of populations disproportionately impacted during the crisis. I am also delighted to report that the frontline heroes at Unity were some of the first recipients of the 7,000 units of personal protective equipment in the early days of the pandemic, part of a $5 million investment CareFirst made to provide gowns, gloves, masks, and face shields in 2020 to hundreds of healthcare and social service organizations. As a testament to our shared vision for health equity, our partnership with Unity continues to be strengthened as we work together to address the pandemic. In May, CareFirst invested $200,000 in support of vaccine implementation, equipment, and supplies for 8 federally qualified health centers across the District of Columbia, including Unity Healthcare. Our $50,000 investment in Unity's vaccine pop-up clinics continue to pay off, as we know tens of thousands of vaccinations have already taken place, and that number continues to grow daily. Thank you, Unity, for your tireless efforts to keep our city safe. Part of the success formula for vaccinations at Unity is the state-of-the-art Unity Mobile Health Van, which every day serves vulnerable residents by providing comprehensive health and wraparound services in a safe and compassionate environment for unsheltered and individuals experiencing homelessness in the District of Columbia and beyond. CareFirst has been so proud to bring the Health Mobile to life. Public health data tells us that transportation is a barrier to healthcare access, affecting many vulnerable communities in a myriad of ways. Adequate and reliable transportation is essential to maintaining a thriving, healthy community. We also know that people of color and in lower income communities in our city are more likely to not drive, have a car, or have access to public transport. That's why the Health Mobile is so important. It is the perfect demonstration of why our shared commitment to improving access to care, especially those that are suffering from barriers in transportation, is essential to building and sustaining community health in our great city. But don't just take it from me. Let's have a look at what the Health Mobile has been up to.
We're looking at the worst scenario, that this becomes a bigger outbreak.
I'm getting ready to move out. Hi, my name is Ernest, and I'm the driver for Unity Healthcare. I've been doing this some quite time. In terms of the outreach, right, I think that I was born to do this, right, because I used to be out here myself. Basically, what we have today is what they call one of the tent city where homeless people reside. And a lot of them feel, though, that they've been left out of society. They had a lot of trust issues. And once they see a familiar face, such as mine, you know, I'll let them know that we're out here today to provide them with a vaccine if they want it. And I would try to encourage them that they need to get it, okay? And I've been getting some good response, right? Because, you know, a lot of them say, man, you know what, you don't know how much you helped me. And it fills me up knowing that I took a few minutes out of my day to listen to this guy, and I made him aware of what I could do.
To be able to have the van out on the street, we are still meeting the needs of the people. We're able to travel around DC area to meet the needs of the people. There's so many people out here that suffer with high blood pressure, asthma, and other acute needs.
There are folks who will come to us that just would not be receiving health care any other way than our going to them in the van. Many are afraid to go into the shelters, sometimes because of a fear for COVID, but for other reasons afraid, so they stay out. So it's terribly important that we go to them.
I really started feeling good when I got on the van. Really, everybody was in place to me. It was pleasant, and I felt good. And I felt secure. I felt that I finally was doing what I was supposed to do.
The van is helping out with COVID vaccines during the week. On Saturdays, we are at McPherson Square, where we see a lot of people there. And the thing about it is that they look for us. They look for the Unity van. They know the Unity van. They know what type of care that we give on the Unity van. And when we pull up, they all just run to the van.
I think it's a good thing that Unity is doing it. I mean, really to give access to people that have no information about it, to help out other people. It's important to me because my loved ones, my friends, and people that I be around, and I don't want to be denied not being able to go anywhere. I'm finding out a vaccine card is like having a passport, baby. Better get it.
it's great to be able to serve this population, because usually they're the forgotten population, the one we want to hide away from society. So to be able to seek them out and go to them and make them a priority today is really exciting and invigorating for us, who have been working with COVID patients in isolation quarantine and seeing the toll that it's taken on patients. This is almost like a lifeline and a sign of hope for us to be able to reach these patients we've been seeing come into our clinics, our hotels, to come out to them and be with them today and help them become vaccinated and be safer in society.
So I'm grateful that we do have the van now, that we're able to administer the care that is needed to the people in the area.
Thank you to Unity's Homeless Outreach Team for putting yourselves out there to reach DC's most vulnerable communities. I'm Kit Halliday with Bennett Communications, and welcome. If you look back through history when a country or community stopped caring about the health, welfare, and dignity of its citizens, that was a sign of a society in decline and foreshadowing of terrible things to come. Lack of access to quality health care strips away not just the health of an individual, but their dignity. English poet John Donne said, "Any man's death diminishes me because I am involved in mankind." It seems to follow that any man who has his dignity taken away diminishes me because I'm a part of my community. Unity Healthcare is one organization that for over 35 years has been willing to step up and ensure that no one in our city will lose his or her dignity because they are not in a position to pay for what is a basic necessity for all of us. Quality healthcare is fundamental to the success of any community, and all Americans should want the community that is our nation's capital to represent a standard of care second to no other nation. True patriotism is being able to point to our citizens and say, we have dignity and we will not allow that to be taken away from us, because we cannot be a dignified nation without dignified citizens. We do not just support Unity in this endeavor, but are proud that they are here to elevate our communities. We are grateful to them for stepping up to the plate to take care of those in need and bring dignity to the nation's capital, our home. So you've heard from me about why it's so important for BENCOM to support Unity, and it's easy for any of us to talk about what we do, but what's it like to be on the other side? To give us a better understanding of what Unity does, really does, let's hear from some of Unity's patients about their journey to overcoming hard times as well as mental and physical adversities. I invite you to step into their worlds for a moment to hear how your support has made an impact that matters.
Hi, I'm Dr. Woznica, and we are here at Upper Cardozo High School, one of our school-based health centers. And we're very grateful to the patients who have agreed to come here and share their story with us. They highlight a variety of challenges, health concerns that are not easy to get adequate care for. What brought you to Unity initially?
My name is Douglas Robertson, and I came to Unity because I was homeless. And in a homeless shelter I was in, they recommended Unity, so that's how I got to Unity, which they've helped a lot.
My name is Denise Collymore. I'm one of your underinsured patients. That's why I came to Unity. But I was introduced to Unity through relatives of mine that came from Jamaica that did not have insurance, and they helped them out quite a bit, and they followed through. And I was the one who would assist them in getting the services, and I was so pleased. And I have been coming with insurance and without insurance, and I'm thankful for Unity for all that they do.
My name's Christopher. I came to Unity through a referral from someone else. I had a growing business, and then COVID hit, and the business was completely put on hold for a long time. So I needed healthcare. I didn't have healthcare anymore. And I got fantastic service. I worried at first about the service that I'd get, not paying for it. But it was better than the paid for healthcare I had, by far, actually. I've never been in better shape now.
The communication is very good. They hear you when you talk, And I suffer from chronic back pain. I have sciatic nerve problems. I've had a number of problems. The comfort is important. If you cannot talk to your doctor and let them hear what you're saying, then you don't meet them. I'm with you 100%. You're bogged down with insurance forms and asking this, and they say you only have 15 minutes and this and that. That's not comforting.
I don't like to discuss this publicly usually, but I came to you for depression. I've suffered from depression since I was a child. And really usually I went to see people and they'd give me pills. And, I'm taking a quarter of the pills I took before, and I'm 1,000 times better, And I think it is because of the someone listening to you and really hearing what you're saying, and not just giving you a standard, okay, they say X, Y, and Z, we'll pump them full of this, And I think you really listen to me, and I feel like it's the first time I've really been listened to, and it did wonders. It really, it's shocking. I mean, really, to me, it was. I'd really given up at that point. I'm 51 years old, and I'd given up, on really not being depressed the rest of my life, going through bouts of depression. But I can actually see, a future now where that doesn't happen, which is amazing.
Personally, when I first started going here, I used to think that I was the only one that had this particular problem, But that's not true. I met different people who has the same problem I have, or worse. I met people who doing better than me, people who doing worse than me, But going to Unity and talking to my physician, she allowed me to realize that whatever's wrong with me is not that bad, and it shall pass, And that's what I get out of Unity. I speak people that would never even get the treatment that they're getting if it wasn't for Unity. I can't pay for the treatment I'm getting, but they pay for it for me. And that's what I like about Unity. My doctor, even though she's not in the office right now, she'll call me on the phone any given day. And just to talk. How you doing? Like she's my friend, a good friend. Just to talk. But she was the one that made me go to the hospital to have my lung removed. And I appreciate her for that. She was interested. She told me she was going to make me her personal project. And that's what she did.
Well, I can share the encounter I had with my general practitioner that I have today that I've been with her for 15 years. Dr. Ziskin had recommended a therapist for me in one of the periods, and I was like, I couldn't believe it because, the stigma that's attached to it, I said, I don't need a therapist, She said, just think about it, and then so I took her advice, Took me a minute, but I took her advice, which I didn't agree with. But once I took her advice, it really changed my life.
I mean, I had 7 operations, 180 days of chemo. I have 4 feet of scars on my body from all the operations. And that leaves a scar, and that's something that medicine often doesn't really take enough account of. And coming to Unity, that's something that really was almost solved, I feel a lot of the medical PTSD is gone. I don't have panic attacks anymore. And it's been a great experience. I mean, it's been transformative.
When I think of Unity, I feel joyful.
It's just changed my life entirely. Even though this was, as I said, my business went down because of COVID. I mean, it went really down. I own a tour company. The tours are dead, and there's been no business, So it could, some people could say this is the worst time of my life, right? Your business goes down and everything. You're locked in your apartment, stuff like that. But because of the care I received, I've been fine. I've been really dealing with it, and in many ways, even with all the adversity, it's been one of the best times of my life. And that's all because of Unity.
Thank you to our patients for opening up and telling us their story. Thank you to all who have participated. As many of you know, I will be retiring at the end of this year. It was a very difficult decision because I feel like I am leaving a family. I have been proud of my accomplishments at Unity, but they would not have been possible without the great leadership, commitment, and dedication of my staff, of the board of directors who have governed us over the past 35 years. The patients, I have learned so much from the patients. They come with their problems and their challenges, but they enrich our lives. We are not just there to help them, they teach us. And as I move on to a new phase of my life, I hope that I can carry in my heart the stories that they have shared with us. Stories of pain, stories of joy, sometimes stories of grief, but always stories of hope. So thank you for helping Unity be what it is today. Thank you to everyone who has played their part.